Hello everyone, I am Dr. Queen Aditya, Senior Consultant Gynaecologist at Papilio Clinic, Kolkata. Your gynecologist will perform the Caesarean operation. Usually a team of 2 gynecologists are there because your life is precious and there are 2 of you as patients, you and your baby. And at the time of the delivery, both the gynecologists, the anesthetist as well as the child specialist are there in the OT. If the hospital authorities allow, sometimes the husband is also present inside the OT. So, and it is done inside the operation theatre of the hospital where you choose to get admitted. Now, how do you go about a Caesarean? Now, when you have been advised a Caesarean or when you have decided that you will go for a Caesarean, usually when it is pre-planned, then we get you admitted a day before the day it has been planned. So, you get admitted with with your checklist, that is, you have your investigations, your entire antenatal file that you will carry along with you. You will carry some basic clothes and the medication that you are already taking. Suppose you are on thyroid medication, you carry that, and if you are on antihypertensive, you carry those along. You bring along all your insurance papers if you are covered by anything, and the booking paper which you must have already got booked earlier, so that slip you will also carry. All of these things you will carry along with you, and you will report to the reception of the hospital where you were previously booked. From the reception, they usually inform us, your gynecologist, and then we are aware that you have already reached. And then the registrar of that particular hospital usually comes and greets you and takes you to the labor room where your baby's heartbeat is also checked by the CTG, cardiotocograph, and then from there you are taken to your room and basic checkup is done, like your blood pressure and your vitals. These things are checked up, and then the part preparation is done, that is the area which is to be operated upon gets shaved or clipped, and you are prepared. Some people advise an enema which might be given, some pre-medication, these things are also given the previous night. You are usually allowed a light diet the previous evening or night, that is a dinner, and after that, suppose you have been posted at 9 o'clock in the morning, as for example, then after midnight you are asked not to take anything, not even water. You are advised not to even drink water, and then if there is any medication, then maybe early in the morning it might be given with a sip of water or so, but otherwise by and large you are asked not to take anything. Roughly an hour before or half an hour before the allotted time, you are shifted to the operation theatre, and there you might be put on IV fluids an hour or 2 before. Antibiotics are also given a little while before the actual procedure begins, and then you are taken into the OT, and there in the OT the type of anesthesia which is already decided by the anesthetist is planned. And during your stay in the hospitals, usually the previous night, it might so happen that you have already been paid a visit by the anesthetist, and that is called a PAC or a pre-anesthetic checkup. In most of the hospitals it is done beforehand. In some of the hospitals the anesthetist may greet you directly in the operation theatre.